Did you know that bloodletting was once a common practice to treat everything from fevers to headaches? It was believed that removing blood would restore balance to the body. Today, we're going to take a closer look at some medical practices from the past that are still used today and why it's crucial to understand their origins. You might be surprised to learn that some of the medical treatments we take for granted have a dark and questionable history. One of the most interesting aspects of medical history is how certain practices have been passed down through generations, often without being thoroughly tested or questioned. This has led to some rather disturbing practices being perpetuated even in modern times. Despite the many advancements in medicine, some outdated and questionable practices have persisted, raising concerns about their efficacy and ethical implications. Outdated medical practices have been a part of human history for centuries, and it's astounding how some of these practices continue to be used today. From the use of bloodletting to the application of questionable treatments, we've seen it all. But what drives the persistence of these practices? Is it a lack of understanding, a fear of change, or simply a reluctance to challenge established norms? Whatever the reason, it's essential that we examine these practices and their roots in medical history. One of the primary issues with outdated medical practices is that they can be harmful to patients. In some cases, these practices can lead to further complications, even death. This highlights the importance of questioning and evaluating medical practices, rather than simply accepting them as the norm. Speaking of fascinating and sometimes unsettling medical practices, we've created a collection of designs inspired by the strange and bizarre history of medicine. If you're a fan of exploring the medical curiosities of the past, check out our themed merchandise on histoedutainment.com. From iconic symbols to quirky illustrations, you'll find something that captures the essence of medical history. Another issue with these practices is that they can lead to a lack of trust in the medical community. When patients are subjected to outdated or ineffective treatments, it can erode their faith in the medical system as a whole. It's also important to acknowledge that some medical practices have been perpetuated due to societal pressures or biases. For instance, some treatments have been used solely because of a doctor's personal opinion or because of a patient's social status. The list of outdated medical practices is extensive, and it's surprising how many of these practices are still used today. From the use of radium in medicine to the application of psychoanalysis, we've seen some rather questionable treatments throughout history. One of the most disturbing examples of an outdated medical practice is bloodletting. This practice was once used to treat everything from headaches to epilepsy, and it's astonishing that it was used for centuries without any real scientific basis. Another example is trepanation, a practice that involves drilling holes in the skull to release evil spirits, or relieve pressure. This treatment was used for centuries, and it's surprising that it was still being performed as recently as the 1960s. The use of mercury in medicine is another practice that's both fascinating and disturbing. Mercury was once used to treat syphilis, and it's surprising that this toxic substance was used for centuries without any real understanding of its effects. Fast forward to today, and we can see that some of these practices have evolved or remained unchanged. It's astonishing to learn that some of these treatments are still used, albeit in modified forms. One of the most surprising or controversial practices that is still in use today is the use of electroconvulsive therapy, or ECT. This treatment involves administering an electric shock to the brain to treat mental health disorders, and it's astonishing that it's still used today. Despite the many controversies surrounding ECT, it's still used to treat severe depression, bipolar disorder, and other mental health conditions. While it's been shown to be effective in some cases, it's surprising that this treatment is still used today, given its questionable history. The implications of this practice for modern healthcare are far-reaching. It raises questions about the efficacy and ethics of using such a treatment, and whether it's truly in the best interests of patients. As we've seen, the history of medicine is complex and multifaceted, and it's essential that we understand the roots of these practices. By examining the past, we can create a better future for medicine and for patients. In conclusion, it's crucial that we evaluate and question medical practices, especially those with questionable histories. By doing so, we can create a more informed and compassionate medical system that truly puts patients first. Thanks for watching, and don't forget to leave your thoughts in the comments below. Have you ever experienced or heard of any outdated medical practices? Share your stories and experiences with us. See you at our next video.